Recorded has started. So here we are, day 3 of Allied Health Week. My name is Deneen Diamond. I am the lead for the Center of Excellence for Health. We are super excited for today's session, very excited for our guest. And I do want to say that all of these sessions are being recorded and they're being shared on our website. And I've already had a lot of teachers reach out and say that the students are asking for them every morning. So super excited to have, I guess, the exposure, but also putting our efforts into some sessions that are really going to help our students make some decisions about their careers and maybe looking at some allied health careers. So without further ado, I am super excited to introduce you to Heather Godfrey. Heather has worked with the Health Horizon Network Clinical Nutrition for 17 years and now the manager of clinical nutrition team for Fredericton Upper River Valley. Becoming a dietitian wasn't something she had dreamed of since childhood, and her career journey took a few detours along the way. And thanks to a random Google search, she found what she enjoys and loves to share her profession with others. It's not a well-known career field. Dietitians are often thought of as people who only talk about diets, weight, and exercise, and are often thought of as the food police. That's far from the reality of what a clinical nutrition professional does, and Heather is excited to share about some of the amazing work they do alongside their clinical nutrition technicians. So without further ado, that was quite a mouthful, but I'm really excited to hear from Heather, and I hope you are too. So handing it over to Heather.
All right, thank you so much for inviting me into your class today. I'm super excited to be here. I am a registered dietitian, so I have extensive education, which I'll kind of go through in a little bit, but I am certified and registered with the New Brunswick Association of Dietitians, and I'm the team lead for the clinical nutrition group here in Area 3. I live and work out of Fredericton. And so when I'm not doing nutrition-y things, I'm home with my husband and my 2 boys. They're 4 and 8. So I could be doing anything from playing basement hockey to Paw Patrol and He-Man at any given time. So it's always great fun growing up and loving to work with my kids and to reach others out there in the community. So I was kind of thinking about this, and like with my kids, as I'm sure with many of you, what I wanted to be when I grew up really depended on the day. And so I couldn't quite remember what I wanted to be when I was younger. So I went to the experts and I asked my parents, I'm like, what did Heather want to be when she was young? And they told me, this is the list. I wanted to be a clown, an engineer, a teacher, a painter, a lawyer. When I was really young, I wanted to be a twinkle star in the sky. And at one point, I either wanted to be a Disney princess or She-Ra. And if you don't know who She-Ra is, then go look up He-Man. And I'm sorry you probably missed that era of TV, which was great. But I didn't have opportunities like you're getting right now to learn about different allied health professions. And I was remembered in high school, I sat down and filled out a questionnaire, and this computer list generated what I might be good at. And I hated every single thing on the list. So I'm super excited that there are opportunities like this for you, so you can get used to different professions, and especially some of our allied health professions with healthcare. And today I'm going to talk to you about clinical nutrition or clinical dietetics, about that profession. So I graduated high school, and what's the question? Everyone asks, what are you going to do? Well, I went and studied science because I love science, and I took a degree in psychology. And I loved it, but there weren't a lot of jobs out there at the time without a master's or PhD. So my parents said, well, you're not going to sit on our couch and mooch off of us, so go find a job or go back to school. So I sat down and I kind of reevaluated my career goals. What do I want to do? I knew I wanted to be helpful. I wanted to work in healthcare. Didn't want to be a doctor or a nurse, despite my maybe earlier needs and wants as a kid. Too gross for me, couldn't handle it. But I wanted something that built on my love of science and something that was always changing and super unique, so I wouldn't get bored. So, like my bio says, I sat down at my rickety white desk, and it was dial-up, so it took a good long time to connect to the internet. But I typed in something like healthcare professions other than nursing or medicine, and hit enter, and a whole new world of allied health opened up for me. So I read about physio and OT, SLP, diagnostic imaging, nuclear medicine, respiratory therapy, all kinds of really cool professions, but one in particular caught my eye, and that was dietitians. First, I thought, no, not for me. And here's the reasons why. I hate cooking, still do. I enjoy chocolate, maybe a little too much. And I wasn't one to go to the gym all the time and work out. I just liked my regular activity. But then as I kind of read into it a little bit more and explored it a little bit more, I realized my perception of what a registered dietitian does is way off. And I was captured by the role of what a dietitian does. They work in medical nutrition therapy. They work for all age groups from kiddos way up to senior citizens. Everyone has to eat. So there's someone involved in that all the time. I could take really cool things like tube feeds and IV and make sure a person was nourished and that their bodies were nourished at a time when maybe they couldn't physically eat food. So for that, checked off all my boxes and I was like, okay, let's give this a try. So I applied to some university program at Mount St. Vincent and got into that and started my degree. And since I'm a registered dietitian now, I can say the rest of that story is history for now. But if you think about it, what is clinical nutrition? And I know there's a lot of confusion sometimes around dietitians and nutritionists. And I'm going to talk to you about what a registered dietitian does. Anyone can call themselves a nutritionist. They don't have to have any kind of special training or education or certification. Dietitians definitely do. And once you have that education first, then you have to continue through the years to make sure that you maintain credential. And then the New Brunswick Association of Dietitians watch really closely to make sure that dietitians are practicing safely so the public's not at risk. So what is clinical nutrition? Like I kind of mentioned, society has a lot of thoughts about what that is. And a lot of people really think dietitians only eat healthy food, love to cook, exercise all day, and are obsessed with healthy weight. And I kind of was trying to picture in my mind what this might look like. And well, it could just be a disaster. So I thought, like, what's the reason behind that? And it goes back to, search engines and just not knowing exactly what the field's about. People have connections with food. So think to yourself, what's your absolute favorite food in the world? For me, it's apple pie and ice cream. How would you feel if someone said to you, you can't eat that anymore? I kind of think of myself, with my kids, I kind of think of myself being like SpongeBob SquarePants, where he kind of like blobs onto the floor. I'd probably feel pretty disheartened if someone told me I couldn't have my apple pie and ice cream anymore. And it's kind of thoughts like that that make people really fearful to come to a dietitian because they feel they'll be judged about their eating habits. Having worked in the field as long as I have, I've worked in inpatients and with outpatients. And yeah, I've been called the food police. I've been told, you're going to take away everything I love and make me eat rabbit food. And like, well, rabbits eat pellets. And what's your favorite food? Yeah, I love that too. So if I'm taking it away from you, I'm taking it away from me, and that's not cool. So that's not how the registered dietitians function. We are food detectives. We treat, detect, and prevent nutrition-related health conditions. We speak with people about what their health concerns are and give them the tools that they need to make healthy food decisions. We work every single day with a dedicated team of healthcare professionals. Beyond our own department, we work with nurses, speech-language pathologists, physios, OTs, doctors, the whole group, to make sure that the care we're providing inside the hospital or outside of the hospital meets the needs of patients. Weight is definitely one measurement we look at, but it's not the only one nor the most important. We look at the whole person. We actually do physical exams and check for weight, blood work, body structure, hand grip strength, and muscle mass to make the assessment of overall nutritional state. The focus isn't on what the ideal weight or BMI is for the person, it's on what's healthy for the person. And that looks different across the board. The nutrition team supports eating food that's part of who you are, your culture, religion, tradition, your family favorites, even foods that bring comfort, and how to make those all balance and work together. And dietitians are there to help the individual, community, or group meet the needs that they have. They also advocate for the profession through policy development, job shadowing opportunities, presentations, and serving as mentors to students who are going through post-secondary education or field placements. So we have a bit of a Batman and Robin team, and one cannot function nearly well without the other, especially here in our hospital setting. We have our registered dietitians, who I said are credentialed and maintain education every year and are certified and watched. So we're the experts in food and nutrition related matters. And we work in clinical settings like hospitals, nursing homes, clinics, or in private practice. We have community settings like grocery stores, teams, sports teams and gyms. There are sports dietitians as well. Government like Public Health or Health Canada. We have administrative roles like managers or team leads like I am, food service providers. So if you think of things like the hospitals or universities, they often have dietitians attached to them. And then there's sales and pharmaceuticals and contract work. Or if you're interested in research or teaching, there are definitely opportunities to do that as well. Our clinical nutrition technicians are our right-hand man, and they are the ones that help with providing basic nutrition care plans and follow-up for patients in the hospital. They have key roles in patient care within our clinical settings, but they also have supervisory roles within food services. So there's a few opportunities there with this group. And this is a profession that I like to highlight a little bit because it's not one that a lot of people in Atlantic Canada know much about. It's very popular in Ontario, but it's very hard for us to recruit to this in the healthcare sector in Atlantic Canada. For education and training, so a registered dietitian does need a university degree in human nutrition, along with 1,200 hours of unpaid internship, as well as writing and successfully passing a registration exam. Once that happens, they do have to maintain annual continuing education and show that to the New Brunswick Association of Dietitians so that they can renew membership every year. Our clinical nutrition technicians require either a university degree in nutrition or some other health-related field, as long as they have some nutrition courses in there. Or if university is not for you, that's totally fine. There is a 6-module 2-year course that's available online in food service and nutrition management. And this is a great opportunity to participate in this clinical nutrition technician training. I can do it from home. We have a few people in our own area right now that are working on it. But again, this is the one that not a lot of people know about. As for continuing education, it's always encouraged every year, but it's not necessarily a requirement or a certification. And so my career path kind of took a few leaps and turns there from my science degree to my nutrition degree. And then after that, I decided I might as well do a master's to add a few extra tools to the toolbox in case I wanted to get into something like team lead later on in the projection of my career. And I completed my internship and passed my registration exam in 2011. After I finished my nutrition undergrad, I was moving to Fredericton with my husband, and so I needed a job, had student loans to pay back. And so don't ever feel badly for reaching out and asking nutrition manager or any discipline manager if there are any opportunities in their group. I wouldn't have known if there was anything otherwise. And I made that desperate email, I believe it was in September of 2005. Hi, I'm moving. Do you have any work? I'll scrub floors, I'll clean dishes. It doesn't matter to me what I do. I want to work. And I was able to be hired into 3 casual positions. First was the clinical nutrition technician, which was an amazing opportunity to learn about the clinical nutrition world, food service patient menu clerk, and a food service supervisor. Now, with the supervisor, it probably wasn't one that I necessarily wanted to do, but it brought money in, it gave me hours, but it also gave me a lot of tools and experience and skills that I wouldn't have gotten otherwise. And it gave me like big picture of how the food service department ran and how clinical nutrition and food services work so well together. And then later on, when I became a dietitian and now as team lead, I'm able to recall those processes and the things that I learned there and apply them to my job today. So it definitely was skill building, and I wouldn't have changed anything in terms of that career development. Some of the positives of my job are I get to help people eat well so that they can heal well and be healthy and have improved quality of life. And I get to move clinical nutrition forward as a Horizon Health priority all the time. One of the negatives of my job is just the confusion that exists between a registered dietitian and a nutritionist. So again, just promoting that a dietitian is the expert. They are fully qualified and trained and certified and maintain your annual membership, whereas anyone can be a nutritionist and they don't need any kind of certification. For skills, what do you kind of need to have for skills to be in this type of work? Communication is essential. You need to know how to speak to people of all different backgrounds, education level, and ages. You might be meeting with children one day, you might be meeting with senior citizens at the same time later on in the day. You have to have a vast dialogue and be able to communicate at all different levels. I remember we had an intern a number of years back, and her first day, she was speaking with an 80-some-year-old woman, and realized that after having discussions, this woman needed a little bit more protein in her diet at the hospital. So she said, well, we need to get some protein up in there. And the mentor was like, whoa, like, A, that woman probably had no idea what you were talking about. And B, leave the jargon for the group that actually knows how to use it. So that's just an example of how important it is to know your audience and to know how to speak with them. We also need to be extremely organized, be able to multitask, and really be able to prioritize needs every single day to meet your deadlines. You never know what you're going to get through the door in the run of a day. People are often fearful when their health isn't up to par, so having an empathetic nature and a listening ear is extremely important as well. And what's important for you that day to talk to them about might not be what they need to hear that day. It might not be their priority. So we have to be flexible in how we do our day-to-day sessions with folks. You have to be curious and be able to participate in continuous learning because it's a science. It's always changing. As part of the excitement of it, we need to keep up with it and best practice. And since every person is different, we can't assume that a nutrition care plan for one person will have the same effect for the next person. So we need to be able to critically think through and problem solve when things aren't going how we expect them and be able to find a solution that will work. In terms of relationships, I always say bye-bye ego. There's no room for ego in healthcare. Teamwork makes the dream work 100%, and we work so closely with every discipline on the units, and that's really the only way we could carry out our plans and have them successfully implemented. And looking back, I probably wish I had known more about the allied health profession starting out. I found the focus when I was growing up in healthcare was so strong on medicine, nursing, pharmacy, that I didn't know anything else really existed. So I might have saved myself a little bit of time by experimenting with some of those other disciplines, but I wouldn't change a thing that I did. I think the other piece is that I wish I had known more about the internship that was part of the dietetics program, because that way I might have chosen my summer jobs and volunteer opportunities a little differently to make them a little bit more appealing as part of the experience that I had to offer and have it more relevant, I guess, to the experience within the profession when I was applying for those things. So what I learned is I get to do everything that I wanted to do. I'm helping people improve their health and their quality of life. I get to use science and new research to back the decisions I make about how to move clinical dietetics or nutrition forward, such as right recently, probably in October, we just launched our Horizon Health diet standards. So basically, we have the exact same diet standards, all hospitals across Horizon now, and that improves patient quality and safety, but it's all based on science and it's all based on evidence and what is appropriate and good to use. And one of the other things I can do is I can look at a bowl of pudding and I can see that it is more than just pudding. I can see the science. And I'm going to finish off with a story about my food production seminar in my last year of university. So anyone that's kind of been to university in your last year, you can sometimes take seminar classes, and these are pretty popular because you don't usually have to do a final exam in them. It's usually a big project. And so I took this seminar, and probably within a week or so of going in, our professor said, "Oh, I'm giving you a final exam at the end." So when the time came, I was like, "Oh, okay." I studied for it. And I remember walking into the room thinking, this is going to be terrible. But sitting on the table was the weirdest thing. There was a bowl of pudding, one sheet of paper, and an exam booklet. And we sat down expecting, more to come, like a nice 30-page exam booklet that had a million questions. But our professor said, "No, okay, exam's in front of you. Please answer the question. I'll tell you when your time's up." And I flipped the piece of paper over, and the question was one question. It said, "Why is pudding pudding? P.S. Eat it if you want." And we all kind of looked around at each other like, what's going on here? And he said, "No, answer the question. Go ahead. You know what to do." And so I kind of like froze for a minute. I'm like, am I being punked right now? What kind of question is this? Why is pudding pudding? It's like calculus sometimes when you have an equation of numbers and you're supposed to get letters. It doesn't make sense. So after I kind of collected myself for a minute and got over the shock of having only one question that was worth half of my final grade, I started asking the questions. Who, what, when, where, why, how? Well, what is pudding? It's this dessert. It's sweet. It's made of dairy. It has the cohesive nature. It's thick. And then the pieces started falling into place. Okay, pudding is made of these ingredients. It uses this technique. If one of those ingredients was off, or one piece of that technique was off, the science of this perfect pudding right now that I have here would be off. Instead of sweet, maybe it'd be sour or salty. Instead of cohesive and thick, maybe it would be a layered liquid mess in a bowl. It would be thin. It was about how all the physics, the chemistry, and the biology of those ingredients and the technique used to make it made this absolute perfectly looking and tasting pudding. And it kind of blew my mind for a minute. I was like, that's what food is. Food isn't just energy and sustenance, it is science. And then I even thought of it further, like if you eat food, your food digests and your body knows exactly how to use the protein, the carbohydrate, the fat, the vitamins, the minerals in exactly the way it needs to. And it kind of, I looked at food completely different after that moment. And I said to the professor after, I was like, "Thank you for this." And he's like, "Oh, okay." And I was like, "No, really, like this just totally changed my perspective on my chosen profession." And I hope at some point in your education or in your professional career, you get to have a pudding moment of some kind, because it definitely had an impact. And it was delicious. I did eat it. It was perfect pudding. So my career advice to you would be do what you love and love what you do. Be open to the possibilities and take every opportunity that you can. Sometimes if you get focused on going from point A to point B and there are barriers and you don't look beside you to see if there's another way around getting there, you might miss out on some really cool opportunities to build skill and to build confidence and to build just problem solving skills. And this will take effort. It takes enthusiasm, but you will eventually get to that end point that you want. It just might be a little bit more of a rounded way to get there. And remember to have good work ethic. This speaks volumes to your employer, to your people that you're hoping to be references for you in the future. So for your teachers and any kind of people that you work for in the summers. Really, really important. Be at work when you're supposed to be there. Don't be on your phones all the time. You tell my son, please don't grunt at me. Use a complete sentence. These things speak volumes. So if you're interested in a clinical nutrition profession, just think to you, what is food to you? What's the value of food to health? And do I even have an interest in that? And if so, this could be exactly what you're looking for. If you want more information, you can check out Dietitians of Canada. They've got a really great section on how to become a registered dietitian. You can check the New Brunswick Association of Dietitians, which is the provincial regulatory body that we work with. And there's always the opportunity to job shadow our team here with Horizon. That can be arranged through education. So I hope I've given you a little bit of a glimpse into our world today. It's pretty cool, and I'd be happy to answer any questions that you might have.
Thank you so much. That was so lovely, Heather. And I love the pudding story. And I have my own little pudding story, but it was lovely to hear about what engages you and what triggers you to become interested in a career. So I think the pudding story was perfect. My little pudding story is that I didn't believe that my husband was allergic to avocado pudding or avocados in general, and put pudding out for him to try, and he actually ate the whole bowl and was in bed for a week. So there's my pudding story, but not to do with careers. But thank you so much for not just speaking about your specific career, but also some of the tidbits that students can make sure that they put into their day when they are going to their job. So the work ethic and being engaged and off their phones and all those good things that we know we hear our parents say a lot, but certainly coming from a professional, it really does help. So I know that we have our beautiful rock star teacher on, Jennifer Kraft, who's had students here for each session. So Jennifer, I'm not sure if you have students with you right now or if they have any questions, but certainly you can let us know. And I guess you spoke about some of the maybe jobs that or positions that maybe weren't a highlight, but if you could pick one, I guess, opportunity that you've had that has been the highlight, and maybe one experience, one interaction with a certain person where you had a huge impact on them. Is there one story that kind of, I guess, tears on your heart a little bit?
There's so many, because I mean, every person's different, every situation that you encounter. I mean, I've seen hundreds of people, and the nutrition support with tube feeds and TPN, which is nutrition through IV, are always like scientifically challenging, which is really cool. But I always remember this one sweet lady. She was 103 years old, and the doctor was trying to put her on this restrictive diet. And I was like, no, that's not appropriate. Like, she's 103. She obviously has done things right to get to this age. So I went in to speak with her and I said, dear, like, is there anything I can get you that you're really missing right now? And she said, oh, I would love to have some ice cream. I was like, sure, you can have ice cream whenever you want. I said, is that the magic trick to you being 103? And she said, absolutely. I had every ice cream every single day of my life, and the doctor wants to take away, and I'm saying no. And so I was like, that's good. This is just showing that, those things are so, so important to people, and it can really, make or break your relationship with someone, but it can also really help them heal. And she was very angry at herself for having fallen and broken her hip. And I'm like, dear, it's okay. Like, I'll get you ice cream if that's what your heart desires. And she, once she got her ice cream, her intake improved, her attitude improved, and it was just a really good outcome for her at that time.
I love that story. So we are allowed to eat ice cream every day. You're not the food police, and you love your job. And I just see that Jennifer says that she's in a meeting next door. And the question's not for Ms. Kraft, it's for the students that are listening. If you guys have any questions, you certainly can put the mic on and ask any questions that you have for Heather. But if not, that's fine too. We're always super excited to have these opportunities to bring our experts to the students and the students to the experts. So I do want to say thank you so much from the Center of Excellence for Health. And it's been a delight to meet you, Heather, but also listen to what you do for your job and hear a little bit about the day in the life.
Absolutely. My pleasure. It's great to be here. Thank you.
I will just put the link in the chat for Horizon's education placement portal. I know that Heather did mention job shadowing, so if there are any students who are interested, they can submit a job shadow request through this link.
Awesome. Thanks,
Awesome.
Julie.
Thanks so much.
Thanks, Jillian. All right, without further ado, I'm going to stop the recording, but certainly if anybody has any questions, you can reach out to the Center of Excellence for Health, and I can direct you to Heather, or if you want to go to the portal and try and figure out if you can do a placement around the career, we certainly advise you to do that. But thank you so much for tuning in, and thank you from the Center of Excellence for Health, and super excited for another session this afternoon and all week. So if you're listening and you're wondering if there's more sessions being offered, we're offering more sessions tomorrow and Friday as well. So from the Allied Health Week and the Center of Excellence, have a great day.